Active COVID cases are continuing to surge. There have been 328 new COVID cases which have been reported in the last 24 hours. 265 of these cases from Kerala alone. One death also reported in the state. So that's the latest as far as the COVID-19 numbers are concerned. The numbers seem to be rising and as far as the active COVID case is concerned, the numbers are surging. 265 cases have been reported from Kerala alone. There is, remember, also a big concern about the new variant and Deepak is joining us live on the broadcast. Deepak, over to you. What's the latest as far as the COVID-19 numbers are concerned and the advisories which have been shared by the centre in the state?
Right, Meenakshi, day before yesterday, Health Minister Mansukh Mandavia held a meeting with all the state health ministers and told them about the preparations that need to be done for the ongoing COVID surge. But let me take our viewers through the active case tally, because this is the data released by the Ministry of Health and Family Welfare, where it clearly shows that there is a lot of uptick in the Kerala tally, because 265 cases out of the 328 cases have come only from Kerala, and the neighbouring state is also increasing because 13 cases have been reported in Karnataka despite the measures that have been put in place. In Maharashtra, there's about 8 new cases. In Puducherry, there's about 5. And another ticking time bomb is Tamil Nadu, because we've seen how the recent rains have triggered flash floods in Tamil Nadu, which could give rise to these kind of influenza diseases. And the state health ministry is also ramping up all the health infrastructure to ensure that they could help contain the spread of COVID-19. And JN.1, which is the new subvariant of its previous variant, is highly spreadable, and it is also very evasive as far as your immune response is concerned. So all the health authorities and also the health ministries across the state and other health officials are on high alert to ensure that there is no outbreak like what we saw in the previous wave. So mock drills are being conducted, testing has been ramped up, SARI and ILI cases are being focused upon, because they also carry the same symptoms as COVID-19 infection. So they're ensuring that there is no negligence as far as the testing and the handling of cases are concerned.
So sources telling us that the infection due to JN.1 subvariant is reportedly mild at the moment. The government saying there is nothing dangerous. It is not a cause of concern. So there is no need to be concerned. There is no need for alarm, but obviously caution, that is extremely important. JN.1 variant cases have been found to be mild. That's the latest coming in. And all of them, all the people who had been infected with the same have reportedly recovered without any complications. Now, the current vaccines are also continuing to protect against the new variant. 21 deaths in the last 2 weeks. They have not been linked to JN.1 variant, and maximum COVID cases have been reported in southern states, that's Kerala, Karnataka and Tamil Nadu. There is no increase in hospitalization. Some states have made mask mandatory, but no nationwide mask mandate has been put out yet. Deepak live with us. Deepak, of course, the silver lining being that there is no travel restriction, domestic or international, considering that it's a time when people take a lot of vacations. It's the year-end, Christmas, New Year time approaching.
Right, Meenakshi, now every time a virus evolves, what we have to note here is that the severity and also the intensity of the infection goes down, because every time a virus evolves, it loses its lethality, and that's why the center has also flagged it, saying that there is no panic and there shouldn't be no panic around this new subvariant, because INSACOG has also been sequencing the genome of this subvariant as well, and they have also found that it might be contagious, but it is not harmful or not lethal. But all said and done,
yes,
we shouldn't keep our COVID guards down. Masking is important.
Masking is extremely important. Jaya Lakshmi also live with us. Jaya Lakshmi, take us through the latest as far as this information is concerned. Obviously, there is a silver lining, some relief for us that the subvariant is mild. It's not dangerous, but just like Deepak was also saying, it's not time yet for us to take off our mask or throw caution to the wind.
Yes, definitely. Even though the cases today in the last 24 hours, Kerala had reported 265 fresh cases of COVID, even though the cases have been reduced since yesterday. Yesterday we saw 300 plus cases were diagnosed from Kerala, but today even the numbers have reduced. The health ministry is still warning us and asking us to stay safe and stay indoors, and also to take all the necessary precautions that is possible, like masking and avoiding going out as much as possible and staying indoors. These are the necessary steps that the health ministry has asked the state of Kerala to maintain.